WAPT News begins with breaking news.
Breaking news now. We are hearing from Governor Tate Reeves and the members of his coronavirus task force. Let's listen in.
With each of you on Friday morning, I have had an excellent trip down to the south part of our state. We had the acting Secretary of the Department of Homeland Security, Chad Wolf, come to Mississippi Friday afternoon, toured the area via air, and then also spent about an hour on the ground. Had the opportunity to speak to many Mississippians that got knocked down, some of whom lost loved ones, and I was very proud of the spirit of the people that we spoke with, and I sincerely appreciate the partnership of the federal government, of FEMA, of President Trump's administration in helping us recover from those Easter storms. And I will get back to that and recognize Director Michelle really soon. As a reminder to everyone on where we find ourselves today, on Monday, April the 20th, we did extend our shelter-in-place order for 1 week. It is now set to expire on Monday, April the 27th. We were able to reopen some small businesses for safe sales, whereas people have the opportunity to go online or make a phone call to these small businesses, and they can, through curbside delivery service, produce those goods for Mississippians. It's one small step towards getting people back to work. In addition to that, we were able to open some of the recreational facilities for our people where it was safe, things like fishing and other items on the reservoir, as well as the beaches, as long as the local governmental entities allowed for it, and as long as we had adequate law enforcement to make sure that we didn't allow for large groups to be gathering. We have to maintain social distancing in those areas, but people have to be able to get out of their house and enjoy themselves as long as they can do it in a way that is safe both for themselves and for their fellow Mississippians. I do want to remind everyone that I do know how important it is that we get our economy open again. We have made small initial steps to do that. As I have said repeatedly, we went into this shelter-in-place order in a methodical way to ensure that we maintain the safety of Mississippians, but also did minimal economic damage if at all possible. But we also recognize that over the last 3 weeks, we've had approximately between 130 and 140,000 Mississippians file for unemployment insurance. That is an unacceptable position to be in. Many of those individuals have never been on unemployment in their life. Many of them are scared, not only for their health because of the virus, they're also scared because of their economic health and the plight that they find themselves in many, many, many instances to no fault of their own. We recognize that, and we're working to build a plan and a long-term strategy to get our economy moving again. Earlier today, we had a meeting with Vice President Pence, the coronavirus task force. Virtually every governor across the nation participated, and the primary focus of that conversation was around testing. There has been a significant amount of talk around testing. It's interesting through this pandemic. For weeks and weeks, the only conversation that was had was how many ventilators do you have and how many ICU beds do you have? Well, it appears to me that at least to this point in the cycle, and from the standpoint of the United States, it seems very, very clear that the peak has come and gone, and while there are still significantly new number of cases across the country, we are seeing significantly less new cases on a day-over-day basis as a country. If you look at the mapping and the modeling that has been conveyed to us in terms of where the United States is today compared to where Italy was at a similar time, we not only have reached that peak, we also were able to keep that peak at a lower level if you look at it from the perspective of relative to the population size, and that's something that I think we as a nation should be proud of. Now in Mississippi, we've got more work to do. We know that, and we're monitoring it very, very closely. But with respect to testing, the conversation in the country has moved from ICU beds and ventilator availability to how much testing availability do we have. And I think that's important. And I think testing is something that we've got to continue to ramp up. And it's something that we as a state are having conversations around doing just that. But what I want you as Mississippians to know, and I have said this to Dr. Dobbs repeatedly, and I've said it in private, and I will say it in public, he and his team have done wonders as it relates to testing. We haven't tested as many people as we want, and we have continued to prioritize those in the healthcare space, those who have symptoms, et cetera. But keep in mind that in Mississippi, we've done over 51,000 tests, which what that means is that we have done more testing than almost any other state that has not gotten overwhelming federal support and overwhelming federal resources. For instance, the state of Oregon has about 1 million more people than Mississippi, and publicly available data suggests that we've done at least 10,000 more tests than have they. The state of Kentucky has about 2 million more people than Mississippi, and publicly available data suggests that we've done about 20,000 more tests than them. The state of Wisconsin has double our population, and we've done more tests than they have. The state of Virginia has triple our population, and we've done approximately the same number of tests. We are very nearing the position of having done 18,000 tests per 1 million population. And in large part, as I have said time after time again, from this very position, in many instances, the number of active cases that one has, and particularly the number of new cases that one has from state to state, is a function of how many tests you are doing. We made the decision early on that we wanted to test to our maximum capacity. We're very fortunate in our state that we had scientists at the University of Southern Mississippi, that we had researchers at the University of Mississippi Medical Center. We had very capable individuals at the State Health Department lab, and they all stepped up. And because of that, we've been able to do significantly more testing than many other states, and that is a real success story for Mississippians in this particular crisis. And I want to personally thank Dr. Dobbs and his team and everyone that has been engaged and involved in that process. That doesn't mean that we're testing enough people. It doesn't mean that we do not want to continue to build capacity. Particularly with these high throughput machines, we can do significantly more testing and we can get results back very, very quickly. We are working very hard to make that a reality. We've got more work to do. We had a long conversation about that on our call earlier today, and I want to make sure that we continue to expand our testing capacity, our testing capability, and more importantly even expand the number of tests that we can get back very quickly, because that's going to be critically important as we move into the next phases of recovery. I particularly want to thank our healthcare workers, the men and women who have been on the front line of this particular battle. I know it has been tough. I have heard from many of you that are working long hours and are absolutely dedicated to protecting the people of Mississippi, and I want to personally thank you very, very much. We are doing everything in our power to continue to ensure that we have adequate numbers of PPE. We had a week last week in which we were able to ascertain large quantities of PPE. We've also had some help from the federal government sending PPE directly out to our Tier 1 facilities, particularly our hospitals and our nursing home facilities. We're going to continue to do that. I'm going to continue to ask you, if you are in one of those Tier 1 facilities, continue to be attempting to buy PPE on the open market. That is critical. And I will tell you that many of you in large hospital systems have more leverage when it comes to PPE than I do, because what the suppliers in the marketplace understand is 6 months from now, you're going to still be buying PPE. Hopefully, I am not as a state. Now, we're going to build up our stockpile. We're going to be prepared if there was another wave in the fall, which is what many people have said may be the case. But please continue to supply yourself, and we will continue to fill in the gaps if and when necessary. We do believe that contact tracing is extremely important, piece of the overall puzzle. We have built teams at the Department of Health who are doing tremendous work. We want to continue to add to them. There is some speculation that the CDC is going to send out teams as well to all 50 states. We don't know if that's true or not, but we certainly believe that's a possibility, which will simply add capacity and add capabilities for our already extremely engaged and extremely talented team at the Department of Health. Our team has done tremendous work to make sure that all the cases are investigated and that those that need to be isolated and those who need to be quarantined are in fact isolated and quarantined so as to slow the spread of the virus. As we look at our data in Mississippi, it is very clear that our curve is flattening. For instance, on April the 8th, we had 210 patients in the ICU. Today, we have 146. The day before, we had 128 patients on ventilators. Today, we have 89. It's a consistent trend. But what we're seeing in Mississippi, unlike the state of New York, and quite frankly, unlike what you see in our nation's curve, due in large part because of the state of New York, they saw a very high peak, which is turned over. In Mississippi, through adequate management, what we have seen is a peak that's not nearly as high or nearly as steep, but it's also probably a plateau more so than a steep peak. And so that's why you're continuing to see more increases in cases and the number of cases on a daily basis basically being, if you average it out over a 3-day rolling period, relatively flat. But that plateau is at a level where our healthcare system is not stretched. It is not in a position in which we are having to turn away patients, and we will have, hopefully, when all is said and done, protected the integrity of our healthcare system, ensuring that we meet our goal. And our goal has always been every single Mississippian that needs access to quality care to recover and can recover gets that quality care, and to date, that has been the case. But because but I also do want to point out that is in terms of our whole state. We must remain vigilant because we know that it's still possible that we may have outbreaks in vulnerable populations such as our nursing homes and other long-term care facilities. We're watching that very, very closely. And also, we know that when the numbers are at a level, as I mentioned earlier, where we have 89 current patients on ventilators, an increase of 10 or 15 or 20 individuals across the state could lead to a fairly significant increase in percentage of patients, and that could be done in one building or one healthcare facility. And so we've got to continue to remain very, very vigilant. But we are confident, as I said late last week, and becoming even more confident, that our healthcare system is not going to be overwhelmed. We're looking ahead to what next week may look like if these positive trends continue. As we move into what we're looking at over the next couple of weeks, we are very hopeful that we can move more and more towards opening up more and more areas, whether that's geographic regions, counties, or statewide in particular industries. More and more of our economy must continue to open up. But we also must understand that if and when we lift the shelter-in-place order, that is not going to be a return to normal as normal existed several months ago. We are going to continue to require social distancing. We're going to continue to ensure that we do not have groups of more than 10 gathering and assembling for social purposes. We're not going to allow large groups to gather on the beach or otherwise. We're going to move into a prolonged period of moving back towards a normal posture, but nothing like where we were just 2 months ago. It's going to take time, but I'm confident that our people will do what you've been doing for the last several weeks, and that is the most important thing you can do, which is to use common sense. And so, as we look to the future, we recognize that we must give our people the ability to fend for themselves. We can't make it illegal to work and provide for your family, not in this country, and certainly not in Mississippi.